The number of eating disorders has dramatically increased in younger patients since the onset of COVID-19. Hi, my name is Dr. Laura Kester, and I'm here today to answer some questions from our Instagram followers on eating disorders. Our first question is, what are some signs that a person might have an eating disorder? Eating disorders can occur very subtly. The first signs often occur in school environments and can consist of things like missing or skipping meals. Oftentimes, friends may see this even before family members. Other signs may be seeing that they're changing the foods that they're eating or that they're cutting down significantly on the amounts of foods that they eat. Our second question today is, if you suspect a friend has an eating disorder, how do you approach them about it? When you're approaching someone about an eating disorder, the best thing to do is to be non-judgmental. Being judgmental can push people away and make them defensive so they don't want to talk about what's going on. The easiest way to ask someone about an eating disorder is to ask an open-ended question like, are you having concerns about your eating? Our third question today is, how can I get help for a friend with an eating disorder? The first thing to do is to talk to your friend about what your concerns are. It'll probably be important to bring their family into the conversation, but you won't want to necessarily do this behind their back. So talking to them about how important they are and the importance of them getting help so that they can get better may be an easy way to get them to open up to their family so that you and their family can then move them in the direction towards speaking with their doctor and getting the treatment that they need. Number 4, are there treatments for overeating and binge eating? There are many reasons that we binge eat or overeat. Interesting enough, our body has many needs. Even when we're sitting around doing nothing at all, our body is constantly growing, functioning, and doing many things that we are not aware of. If we're not getting an adequate nutrition in order to meet these needs, our bodies will often crave excess food, which can result in binge eating and overeating. We also overeat and binge eat for emotional reasons as well as for boredom reasons. For these reasons, part of the treatment incorporates not only having a balanced diet that meets all of our body's needs, but making sure that we're engaging in psychological treatment to assess all of the different reasons that we may be binge eating or overeating. There are also medications that can be available to assist with this if needed. Number 5, how can I build a healthy relationship with food? Building a healthy relationship with food requires us to understand and remember that food is an important part of our functioning. So although we often will eat for pleasure, as we should, food is also important in making sure that we have all of the nutrients we need for our body to function. Building a healthy relationship requires that we are able to get all of those different foods in. Remembering that every single food we eat, no matter what it is, has some nutrients to offer us. Remembering to balance our meals and remembering that all things in moderation are fine for us to eat helps us to have a healthy relationship with food and a happy life. In today's society, there's so much conflicting information about what we should be eating, what we should be doing for physical activity, and our bodies overall. This can be very confusing, particularly for kids. This can set up an increased risk for development of an eating disorder. If you have concerns that you might have an eating disorder or someone you might know, please get them or yourself connected with a doctor. If you're local, please feel free to reach out to us at 1-800-UCD for Kids.